5 on your health tonight. The first overdose death from a powerful new street drug. Experts say even in a very small dose, it can be lethal. Here to tell us more is Dr. Ali Raja, the Vice Chair of Emergency Medicine at Mass General Brigham. Good to see you, Dr. Raja.
You too, Eric.
All right, Dr. Raja, we know you've read the reports about cychlorphine. How dangerous is it?
Well, Ben, cychlorphine is still newly emerging, so we don't know everything about it yet. But what's getting people's attention is that early lab data suggests that it might be more potent than fentanyl. Now, we shouldn't start to panic or overstate that. That's based on lab data, and we don't have a lot of real-world human data yet. But what we do know is that, as Erica just said, it's already been identified in at least one fatal overdose. And like other opioids, the main danger is that it can slow or even stop someone's breathing.
So, as you mentioned, this was an overdose death, and it happened in San Francisco. Have you heard about any cases in the Boston area?
Eric, I've done a little research, and I wasn't able to find any confirmed cases in the Boston area thus far. That being said, we've seen this pattern before. Once a substance shows up in one city, it really doesn't tend to stay contained for long. So cychlorphine has been identified in other places around the country, not just San Francisco. So while I don't know if it's here yet, I wouldn't assume that we're somehow protected from it. From a bigger public health perspective, the bigger issue is that new substances keep entering the drug supply, and they're often hard to detect and easy to miss.
All right, so you mentioned, Dr. Raja, it is an opioid. So does that mean you can still reverse an overdose with a spray of naloxone or Narcan?
Yeah, Ben, I'm really glad you asked. This is really, really important. Naloxone should absolutely still be used if there's any concern for an opioid overdose. It's safe, it's widely available, and it can definitely save a lot of lives. What's tricky about something like cychlorphine is that because it may be more potent, one dose of naloxone might not be enough, and you might need to give repeated doses. Another challenge is that the usual fentanyl test strips actually don't pick this up, and so someone could be exposed without even knowing it. But the response doesn't change. Give naloxone, call 911, and stay with the person until an ambulance arrives.
Okay, Dr. Raja, thank you for the advice.
Yeah.
Thanks, Eric. Thanks, Ben. And Ben, I'm really looking forward to that segment at 6 o'clock.
And Dr. Raja, before I have you, thank you to you. I was texting Dr. Raja all through my ordeal, and he was very helpful with advice and recommendations. So, Dr. Raja, you're a real pal. Thank you.
I'm just glad you're okay.
We are lucky to have you. Thanks again, Dr. Raja.